either through their employers or people who are working have been actually going in for. It's a middle band, which are the self-occupied people as well as business communities and people who are having professionals on their own who have not actually opted for this. So if you look at it, 28% of our population in some way or the other has got some sort of coverage. Health insurance premiums grew from 741 crores in 2001 to 27,000 2015-16. It is 16-17. It would be ending. The figures are here. It's around 32,000 crores, and we expect by 2022 we should be touching around 1 lakh crore. It is going to be a 1 lakh crore health insurance industry. The growth is still. If you look at the distribution, actually, as of today, 44% is from the retail insurance, which we mean individually bought insurances. 44 again percentage is for the group employer-employee, and around 12% is coming from the government schemes, the premium in terms of that. But when you talk about the number of persons covered, it is just the opposite. It is 80% of the number of people covered are in the through the government schemes. Evolution of health insurance: indemnity, just hospitalization insurance; indemnity, all expenses, including outpatient treatment, preventive care, etc., and of course managed care. Today, unfortunately, in spite of insurance sector getting as early as it's nearly opening up at 2001, but still today we are still again majority in the hospitalization section. We have not been able to move for the comprehensive or preventive care. We are trying to move over it, and it should be happening. Product concept: you have it's different products which are for hospitalization. You pay for, get your reimbursement or cashless facilities. Then you have got different products which we are trying to introduce, medical saving accounts, which happens in US as well as Singapore, which is something which we are trying to work out. What has happened is, again, apart from this, now, along with OPD, wellness benefits have been recognized by the regulator. So we have started wellness also being part of insurance coverage. So that again becomes a big opportunity which is coming across. Now, in the future days to come, employers are worried about increasing healthcare cost and are forcing insurers to act as risk managers and risk distributors. Earlier it was insurance, a concept of risk distribution. Distribute the risk over people. Today, as the time evolves, we are becoming risk managers. I would prefer a person gets into a particular cover, or an employer would wish that, okay, you ensure that along with the cost, the health of my people is managed. So maybe wellness benefits, preventive care is going to reduce, good OPD care is going to reduce hospitalization expenses. So the concept is changing. It's actually moving over to the wellness and preventive only from the hospitalization basis. Now, insurance companies will also look at cost optimization and would require utilization reviews. It would involve profiling of providers, doctors, physicians, education programs. As insurers, we would require expertise in domain of healthcare delivery as well as healthcare management. This is where the role of growth of health insurance. Growth of health insurance is an opportunity to improve healthcare standards, especially healthcare infrastructure and accessibility to quality care. This will promote uniform standards of healthcare across the length and breadth of the country. Success or failure of any health insurance program depends largely upon the quality providers, network of quality. This can help remove urban bias and develop healthcare infrastructure in rural areas. RSBY is a good example. In fact, one of the conferences, similar conferences, the benefits of RSBY, pros and cons, etc., which were being discussed. A doctor himself got up and he said that I was working in a hospital in Delhi. I always dreamed that I should own a hospital, but I could not afford to own a hospital in Delhi and run my own. I was working as an employed with a hospital in Delhi. But because of this particular scheme, RSBY scheme, I went back to my native place in UP. I opened up my hospital there. Because of this insurance scheme, a lot of people started getting covered and money started flowing to the hospitals. I got empaneled. So that is how infrastructure actually, if the financing mechanism develops, and financing mechanism can develop more effectively through the instrument of insurance. If this and can go fastest across the length and breadth of the country. Now, oh sorry. It's a specialized field of insurance. There were days when we were in the public sector, there was no private sector. We didn't have any doctors or paramedics who were doing health. The moment the private insurance came in, we recruited doctors. Today, 25% of the workforce in any health insurance division of a general insurance company would be minimum 25% would be medical forces. You would have doctors. We may have BMS, BHMS, MBBS, would have hospital management graduates. And in fact, they have contributed to so much in development of this particular line of business, because a lot of credit goes to the expertise which we could get in developing new products, managing new products and managing the business much well, understanding the business much well, because the doctors came in. Right from sales. Earlier sales, it was not required. People never used to have people. Today, we have brokers who want hospital management graduates, who have sales of insurance companies in the corporate sales department. They talk about requiring hospital management graduates who understand medical. Underwriting is a process where we talk about underwriting a proposal, accepting a business. So in case of retail underwriting, exclusively we have only doctors. Retail underwriting team contributes only doctors who are there. What is it required? Yes, good knowledge of understanding of, second is an open mind. We always say it's an open mind, because you're doing business here, you need to have an open mind. And there is a department called pre-policy where you actually, while underwriting, you have pre-policy medical checkups which are done. So you medically evaluate the entire thing. So the entire pre-policy as well as the underwriting part is totally managed by doctors. Claims management, the claims assessors are basically paramedics. You have people like nursing, graduates in nursing or any of this who actually understand medical terminology well, and they are actually there for assessors. The decision makers for claims are basically all doctors. So again, it's very, we don't, unless a doctor has seen the claim file, it doesn't go through. We would actually allocate limits for their thing, and junior doctor could be up to a particular amount, a senior doctor, etc. But no claim file in a private health insurance company or a private health insurance division would go without scrutiny of a doctor. Networks, which is creating a network of hospitals, diagnostic centers, whatever, the entire, basically where we have specifically, it's headed by hospital management graduates, postgraduates basically. We have got, if I need to talk about my company, my chief underwriter is a doctor. My claims head is a postgraduate in hospital management. He is claims and networking head. So the major two pillars for the department is headed by doctors. Now, as I said, wellness and preventive care have been introduced under insurance programs. You have nearly, this has given a bigger fillip, much bigger requirement. I think that's all. As I said, 20-25% is there. I also got the yellow slip. Fine. Thank you.
Yeah. May I request Mr. Narendra Bharate, MD and CEO of Seed Infotech. He will be talking about the opportunities in IT sector, which is an happening sector, and healthcare now engrossed completely with the ITs. I think he will throw some light on that and what opportunities you have in that area. Probably he will be able to speak up.
Good afternoon. If you recall the days 2 or 3 decades back, and what was the situation of IT as far as banking, finance, and also sectors are concerned, similar is the situation of healthcare now. The IT industry grew in leaps and bounds in last 2 to 3 decades because of what were the software that they have written for the banking industry, the insurance industry, the engineering and manufacturing. As far as the healthcare is concerned, we would say, I represent the IT sector, we say that healthcare is the future. With a lot of maturity and stability which has come in the finance sector and the implementation of IT in finance, here are the days where the implementation of IT is going to be phenomenally growing in the next couple of decades, and this is, I would just say, a start. So if you see the numbers are really huge. There is $134 billion market of healthcare in the world. And if you look at the Indian market alone, it was $1.2 billion in 2016. It's going to be $1.5 billion in 2020. The market is growing. If you were attentive in the previous 2 sessions, the hospital management as well as the insurance, and if you see the workflow, when a patient comes to a hospital or even before coming, the patient tries to figure out which hospital to go. He's trying to figure out which place to go, either by an app or a Yellow Pages or something of that sort. So there are companies like Practo, which is helping the user to figure out which hospital to go. And maybe take an appointment with the help of the app which is installed on your mobile. And instantaneously, the thought comes to your mind, who is writing this whole thing? So it's very obvious the latest technology which is there in IT is immediately being implemented in healthcare, and mobile app development is just one part of that. With this growth, which is almost 11% compounded annual growth year on year, which is going to grow and continue in India and abroad, all the IT professionals, all the IT companies in India as well as abroad see a huge opportunity here. The healthcare providers and the healthcare payers, the insurance companies, all of them, when they are treating the patient, when they are taking the information, they just can't do this manually. So it's very obvious that there has to be a software. It could be a web-based software or a desktop or maybe a mobile-enabled software which is taking the information, and the amount of information that is getting captured in each and every transaction. It could be the electronic medical record of a patient. In every transaction that's doing, it's stored in the database. So though this slide is not very clear from the distance, I'm trying to just share what are the different areas in healthcare the IT opportunity is there. For example, clinical admin, the digital made devices. So I think most of you, some of you, those are in this room, are using the Fitbit. And there are many variables which are coming up. The variable that you see is nothing. The variables which are on the design board of many companies, which are going to be soon coming, and we all would be using. They would be generating a lot of data, and with support of Bluetooth or internet, that would be captured. So there is a lot of data which is getting captured, which will also has to be analyzed, and maybe analysis, which could be the descriptive analytics, what has happened in the past, the predictive analytics, what may happen in the future, and based on what has happened in the past, can we prescribe, which is also called as prescriptive analytics. So people, those who have done maths, statistics, are also required in healthcare to write these analytic algorithms. So I see the career opportunities in IT could be in primarily 2 categories: the solution providers, and the second category would be service providers. In case of solution provider, it is the providing the niche, the components and the turnkey solution for your end user. The end user could be a doctor, a general practitioner, or it could be a clinic or a chain of clinic or a mid-sized hospital or a large hospital. In case of solution provider, the person, one who is engaging with the user, which is a healthcare provider, will have to understand her domain pretty well, just not the technology. And he will have to, having understood what is a problem statement, what are the requirements, he'll have to start devising a solution, maybe create an architecture, create a design, and then start implementing test, and then deploying it. The typical IT careers from the solution track would be the solution architect. If it is a small application for a doctor, it would be a very simple one, not a great architecture would be required. But just imagine Apollo as a group of hospitals, and if they have to use a system where a patient going to one place of Apollo, maybe some other day he goes to another city and visits the another center of Apollo. And information that is already available of that patient in one hospital in one city should be seamlessly available in the other city. So, in case of such an application, the architecture becomes a very critical thing. And solution architect is a person, one who envisages the short-term and long-term requirements of the hospital, and based on that, create an architecture of the software. Then the designer will take it, put this into a proper design, and then it will be passed on to developers to start developing the various modules. In case of service provider category of IT professionals, it's more technology oriented. The team need not be aware of the domain of healthcare to the extent the solution provider and the roles out there are concerned. So the solution providers would provide the technical services to the industry. The key functions would be technology services based on the tools and technology. The typical IT careers in this case would be a software developer at an entry level or a senior developer, the analyst, a business analyst, one who takes the requirement and puts it down in a paper and create the requirement specs document, the support engineer, having created a software, when it is implemented, the after-sale support is also important. And there are sometimes the software engineers or the engineers, those who know the infrastructure management and they can maintain the software. The project manager, because the large projects have to be managed, and it is just not one piece, but many people working, maybe not just in one place. It could be multi-locational project to be managed. So project manager is another career that is required. Network engineer. It goes without saying that in the today's world, everything is network enabled. So a right amount of understanding of networking and what kind of networking is required for a particular application and particular site is also important thing. The most important thing in healthcare is the security of the data which is getting captured. The data of a patient and each and every transaction which is the doctor that is making, how secure the data when it is stored in a database. Are the doctors, since they are not the experts of information security, made aware of the security protocols? And it is not just information security, sometimes it could be cyber security. If the software at the company is enabled on a network, there could be possibility of attack on this whole thing. Somebody can hack from any other country and they could take the medical records of the patients in that particular hospital in any other country. The database administrator. The amount of data which is generated in healthcare industry is so voluminous that the database administrator is becoming a key position. We have seen since for last 10 years, we have deployed in 12 odd countries, 300 installations. What we have seen, most of the doctors are not aware the importance of not only data security, but how to protect the data. It is seen that the passwords are so common that anybody within the hospital can hack the machine and copy the software. Not only that, in case of disaster management, if something goes wrong with the network, if there is a short circuit, or if the server on which the data is maintained is blown off because of some reason or the other, is the data available at any other place so that in case of such a disaster, the data can be recovered within few minutes to hours. Most of the hospitals, the data which is stored in the servers, the situation is so vulnerable that the data can be easily copied, and if the data gets damaged for any reason, the data cannot be easily recovered. So we see a serious problem that is about the awareness of the hospital managers and the doctors and all the people, those who are using all these things, aware about all such requirements. And there are careers which are required to create this awareness and then implement the solutions to all the problems that we see. The typical IT careers that we see along with this is the medical coder, one who takes the information from doctors and put it in the machine. Then somebody who puts it in a right format, does the analysis of that, and then we can manage it as an information so that a lot of analytics algorithms could be experimented. the hot skills that we see in healthcare IT would be like this: a full stack developer, a person, one who has a general overall understanding of most of the aspects of IT lifecycle development and can really write a solution with the support of the rest of the profiles. One of the very common problem the IT companies are facing, and that's one of the reason that most of the solutions which the IT companies are creating are not being used efficiently, that the softwares are not user friendly. The doctors, the way they think and they would like to access or add the data in the database, the software solutions which are created are not user friendly. The user experience and the easiness of use, the UI UX experts is becoming a growing requirement in this industry also. So UI UX designers, they look at the look and feel, how easily the data, the user, the doctor or a nurse or any other administrator in the hospital can easily use it. And the user experience is one of the important thing. These experts take care of that and implement with support of the programmers. Cloud engineers. Sooner or the later, most of the data that we enter in the hospital will be available to any person at any place. We understand by 2019 or 20, the government of India is coming with a healthcare cloud. With SNOMED city-like standards, the record of any patient in any hospital would be available to that patient in any other hospital, provided all the systems developed in various hospitals can talk to each other. SNOMED city is one of the standard India government has accepted, and they are planning to adopt it, though the GR is there, though it is mandatory for the doctor to have the electronic medical records stored. But even today, the penetration of the IT systems in hospitals is not up to the mark. You will see significant change and improvement in next 2 to 3 years, because the government of India is putting a lot of restrictions, because considering the importance of the healthcare data of an individual and the accessibility of healthcare all over the country, the information will have to be brought on the cloud. And hence, the lot of requirements of the cloud engineers, how to create the cloud or how to use the public clouds or private clouds, and then security would become the necessary skills in this industry. Each and every individual, and the way the mobile is getting penetrated in our country and all over the world, most of the user interfaces, not only on the web application or a desktop application, is necessary or should be available on a mobile. So whether it's an Android application or iOS application, large number of mobile programmers are being deployed in healthcare industry, and these are the growing skills required for healthcare. As I said, cybersecurity specialist, the big data specialist, data scientist, and AI specialist. I'll give one interesting case study. There is a hospital in Hadapsar, and we deployed our software for last 7-8 years. There's a huge amount of data. The doctor shared a use case that what medicines that we should store in what month. Can you tell me how to do that? So we started applying the predictive analytics algorithm, and we have given this solution to them that in the months of, say, June, July, August, September, it's a rainy season, a typical what type of diseases are seen, and with the past records of last 3-4 years, which medicines were prescribed, we have built an algorithm with which the prediction can be done and the pharma stores can be easily managed. Some of the other skills which are coming up. So each and every new technology in IT is being used in healthcare, and it's very obvious that healthcare uses all the IT technologies, and these are the growing careers in healthcare as far as IT is concerned. So with this, I would summarize, healthcare or any other industry for that matter cannot survive, cannot grow without IT. And there are huge amount of opportunity